Hello everyone and welcome to this COVID-19 vaccine Q&A event, which is being brought to you tonight by the Plymouth City Council in partnership with the NHS and the universities across Plymouth. My name is Emi Dowse and my pronouns are she and her. I am the Vice President of Education at the University of Plymouth Students' Union, and I'm joined tonight by my panel, and they are Dr. Alex Degan, who is the Medical Director for Primary Care for Devon, Sue Wilkins, the Associate Chief Nurse and Director of Max Vaccination, Flu and Testing at the University's Hospitals, Plymouth NHS Trust, and Ruth Harrell, the Director of Public Health for Plymouth. So before I get into it, I just have a few housekeeping points to make. So please note that this event is being recorded and it will be published on the council's website and shared also by the universities in Plymouth. So just note that. It will be recorded, so if you want to turn your cameras off now, you can. All attendees other than the panel are going to be muted just for the initial presentations. Once that's done, if you do have a question to raise, then please raise your hand. You'll have a virtual hand at the bottom of the screen. You might need to put your screen into full screen to see it. Sometimes it doesn't show, but if you do that, then you'll be able to put your hand up and I'll call on you and then you'll be unmuted to ask your question. If you do want to speak and you do want to turn your camera on, that's really welcome. We love to see your faces and know who we're speaking to, but also just remember that it is being recorded. And of course, you can use the chat function throughout the discussion. We'd love to hear your thoughts and views on this. And finally, everyone will have been sent the event etiquette beforehand, and this is just reminding you that you need to be respectful of all the speakers. We won't need to, but if we do need to mute someone or remove someone, then the event staff will do so. And if there's any problems throughout it, then we will communicate with those individuals by chat or either inviting them into a joining virtual discussion. So after the event, all of the attendees will be emailed with any of the relevant links or information that is shared throughout this event. And again, it will be on the council's website if you do want to go back and look at it. So, as I said earlier, I'm Emi. I'm the Vice President of Education at the Plymouth Students' Union. So what that means is I represent all the students at the University of Plymouth on everything to do with their education. So I work closely with students and also the university. If you're here tonight and you're not from the Plymouth University, but you're maybe from Marjon or City College, then welcome. You're very welcome to be here. And we also want to make sure that you feel as comfortable as possible. So why I believe it's important for students and young adults to take up the COVID vaccine is because mainly I've been hearing a lot of feedback throughout the year from students at Plymouth, but also across the country, that they want to get back to as close to possible at their normal university experience, and for them to go back to as much in-person teaching, but also extracurricular activities such as sports and societies, and also maybe the odd night out as soon as possible. And this is only possible if we keep the rates down and keep them down once they are starting to reduce. And the best way to do that is obviously by vaccinating as many people as possible. The other important reason is because students move across the country so much. And as we all know from before COVID, freshers flu it's fully natural and it always happens. So if you imagine that happens every year, then the spread will also be more likely to spread COVID as well. And finally, the most important thing is that we want students to feel safe and we want them to feel comfortable when they come and study in Plymouth. And that also means that if you are questioning and you are a bit confused or concerned about the COVID vaccine, then we also want you to feel safe. And that's why we've put on this event today. We want to make sure that you have all the necessary information to make the decision for yourself about whether you want to take up the vaccine. You know, as students, we are always taught that we need to question everything and we need to do our research. So I'm glad that you felt comfortable enough today to ask your questions to Plymouth experts, because ultimately you want to make sure that you're getting your information from the right people. So with that in mind, I'm going to head us over to our first presenter of the evening, and that is Ruth Harrell, who is the Director of Public Health at Plymouth City Council. So thank you, Ruth.
Thank you. Thanks, Emi, so much. And thank you all for joining us. And I couldn't agree more with the comments that Emi made. Your opportunity to ask any of those questions that you've always wanted to know about COVID or that just occurred to you at the time, please do go ahead and ask. I was going to give you a quick overview of where we are in Plymouth, and I could talk about this for a very long time, but I promise I won't. So hence, please do ask questions if there's something of interest I've missed out. What I would say is, we've been through it across the whole country, haven't we? So have most places in the world. In fact, we really have been through it. We have been a combination of quite lucky in Plymouth because we're a little bit isolated from the next big urban centre. So I think that's helped with the spread. But I think we've also been lucky because people have taken so many precautions to try and keep each other safe. And I always, count my blessings and do absolutely appreciate that there is an element of luck in that. But I also know that so many people have tried so hard. And we've seen that. We saw that in particularly in the last wave, where we saw how much the universities and yourselves as students were working with us all to try to manage any of the smaller outbreaks that we got and keep those figures down. And unfortunately, we had to go into a full lockdown as a country, and it worked. Lockdowns do work. And the reason that they work is because they take away your freedom to make choices, and they make it impossible for you to go out drinking, and they make it very difficult, or make it breaking the law, for you to go into other people's households, etc. And so they do work. And it's not, it's not rocket science. The disease comes out of your mouth when you talk, particularly if you cough, particularly if you sing and things like that. And so if somebody is standing close enough to you, if it's indoors and not very well ventilated, and you're not wearing a face covering, etc., there's a high chance that the virus will get to you. And that's not rocket science. Distance makes the difference. Not mixing makes a difference. So obviously our rates dropped down, and they dropped down nice and low. And then, of course, we started to unlock from lockdown, and we also brought in new variants. And those two things combined have led us to where we are at the moment. And where we are at the moment is in England, we are a couple of weeks into a turning of the curve, and you can see that those rates are going up. Today they're at 50. A week ago, they were, I think it's 60-something% lower. So they are following that exponential curve where they approximately double. And with COVID, it seems to approximately double about every 10, 11 days. So once they start going up, they tend to keep going up if we're not either very, very careful, very, very lucky, or we also have things like vaccines going on. And that's obviously the point of us having this conversation today. The vaccine we'll talk about in more detail, and I want to just stress that the vaccine is brilliant, but there are some things that it's not 100% on, and we will go into more detail with that. There's a logic at the moment that says we should just open up, and if we open up, what will happen is lots and lots of people who aren't vaccinated will get a mild illness, they'll all recover, we'll all be immune, the vulnerable people who've been vaccinated will be protected, and it will all be fine. But the stats doesn't work like that, unfortunately. For a start, we don't want lots of young people to be ill, because though some people have virtually no symptoms, some people have quite a nasty illness from this, even those who are young and healthy. Things like long COVID, you all have heard about, where the symptoms can persist for quite a long time. We don't know how long yet. There are some people who've had COVID very early in the pandemic who are still having symptoms. So we don't know the extent of that. But also the other thing is that the vaccine doesn't completely stop transmission, and it doesn't completely stop you getting the infection. It just stops you from being very seriously ill. And of course, that's very, very good, but it doesn't mean that it stops it dead. And there are some people who, if a vaccine is not 100% effective, some people will get COVID, some vulnerable people will get COVID. And some people's immune systems don't work well enough to make the antibodies that you need. So there are always vulnerable people out there, even if they've followed all of the advice. And so that's why we still have to take care. So the vaccine obviously is really important. We're going on to talk about that. But I also wanted to just emphasize the importance of what we've done all along, which is trying to keep a social distance from people. Yes, we're able to meet up in groups now. We're able to meet up with our loved ones, but just take care doing that. And one of the ways you can help to take care is by using a lateral flow test twice a week. And I know that you're all familiar with those because you've been using them as part of your, your ability to go into university. But we're asking everybody to do that. And that's a message that we're trying to get out there. It's not as out there as embedded in what people are doing that I'd like. So I just want to take that opportunity to say it. Please do take a lateral flow test twice a week. If you find that you're positive, isolate and book in a PCR test. And be alert to the symptoms. COVID is still out there. What we're seeing in Plymouth is that our rates are going up too. We're probably a couple of weeks behind England, but they are going up. Partly that's because we have opened up and we're just seeing, the B117 variant, which is now called the Alpha, just milling around and starting to be passed. But we also know that a more infectious virus, the Delta variant, is out there. And it's going to start spreading. And when you see what it's done in other areas, it's more transmissible and it's potentially appears to be more serious as well. So for all those reasons, we've got to keep up all the other measures as well as the vaccine. And so just wanted to say that, and thank you for having enough interest in COVID to be on the call. Please help in getting those messages out, and please, if there's anything I can do to help with getting those messages out, give me a shout. So as I say, position in Plymouth is that we're sitting about 18, which is about the same as the Southwest overall, but it is going to go up and we don't know quite how much it's going to go up yet. And certainly the 21st of June is in question as to whether we go to that next stage of the roadmap. And I think very rightly in question at the moment. So we are in for still some rocky times over the next few months. And so all of those measures really important, as is the vaccination. And that was all I was going to say. Thank you.
Thank you so much, Ruth. That was really important to hear. I didn't even know that we're about to go up, so it's useful to know. I'm going to move on to our next presentation, and that is from Dr. Alex Degan and Sue Wilkins. So I'll invite you to come up and do your presentation now.
Thank you, Emi. Ellie, are you able to put the slides up for me, please? Lovely, thank you, Ellie, and thank you, Emi and Ruth as well. As Emi introduced me, my name is Dr. Alex Degan. I'm a GP, actually at the other end of Devon from you in mid Devon. You can probably see over my shoulder. I'm actually sat in my practice at the moment, but I also have a role kind of leading and representing primary care. So that's essentially the GP practices across the whole of Devon with regard to the services that they provide. And actually over the last 6 months, I've also been the medical lead for the vaccination programme across the whole of Devon. So thank you very much for asking me to come along today to present. So I'm going to tell you a bit more about the vaccination programme generally, and I'm going to hand over to Sue in a bit, who's going to tell you a few bits and pieces as well, but hopefully give you a kind of a really broad overview of what's going on with regards to the programme. Just before I do say that, I'm just interested in hearing Ruth there talking about long COVID, and we do know that actually statistically, the younger you are, the less likely you are to have severe illness. But I think it's really important to think about the effects of long COVID. Actually, just before I joined the webinar, I was going through some of my blood results and documents of my patients, and I've got about 1,400 patients that I look after in total. And just off the top of my head, while Ruth was talking there, I was trying to think of the numbers that I've got that I've referred into the long COVID service for assessment, and I've probably got about 5 or 6 out of 1,400 odd patients. But interestingly, when I was thinking about them, they tend to be, they're probably not as young as most students, but actually a lot of younger people that have been seeing me with their long COVID symptoms and needing onward referrals. So long COVID is definitely something that we need to be aware of, and a good reason to get vaccinated. Ellie, sorry, can you go on to the next slide? Actually, sorry, can you go on 2 slides? Because I just realised I've talked about the second slide, which is just the introduction. That's great, thank you. So the vaccination programme in England started back in December. I can't believe we're kind of 6 months in now. As probably most of you will know, actually we're vaccinating the population in line with the priorities set out by what's called the JCVI. So the JCVI is an independent body which essentially advises the country with regards to vaccinations and how we should be doing it. So the NHS across the whole of the country is following their recommendations. As I said, we've been going for 6 months. It's been going, you've probably seen in the media actually, but it's been going really well across the whole country and in Devon as well. Actually, I'd really like to thank my colleagues in the NHS, both from GP practices, the mass vaccination sites, who have been involved, because it's been a real team effort, kind of pulling it together. Actually, some of you watching this may well have been working as volunteers in some of our sites. So thank you to you too. You'll see some of the figures there. So up until the end of May, about 770,000 people in Devon had received their first vaccine, and 550,000 second doses have been given. So in total, we've given over 1.3 million doses of COVID vaccines in the county. The majority of those are the Pfizer and AstraZeneca vaccines, but also we've been given some Moderna, which predominantly actually is around Plymouth, and Sue may be able to say a little bit more about that in a little bit. Could you just go on to the next slide, please, Ellie? Yeah, so naturally, well, we've only known about COVID for kind of 18 months or so, haven't we? It's a very new condition. It was a bit odd with Emi describing me as an expert in COVID, when actually it's only been around for 18 months. I'm sure there's still lots that I can learn about it, and lots that actually we need to learn in the medical profession, because actually we're probably going to need to live with it to an extent for some time yet. But what I'm hoping to do today is to, as I said, give you an overview of the vaccine, share some information about the vaccine. Again, there's all sorts of places where we can go to get information on the vaccine. Some places obviously more reputable than others. But what I'm hoping to do is to give you some accurate information and answer any questions that you may have. So we've actually already received a few questions in advance. So what we'll do just in the next few slides is just try and answer some of those questions that have been submitted, and then throw the floor open to any other questions that you care to ask. So if I can just have the next slide, please, Ellie. Thanks. So the first question is, when will I get my vaccine? Which naturally is probably right at the top of everyone's list of questions to ask. I mentioned a couple of minutes ago that the JCVI are the body that recommend how we should be vaccinating, and the NHS is following their advice. So with regards to yourselves as students, you should be vaccinated when your age group is invited for vaccine, unless you fall into a group that's already been invited for their vaccination. So again, if just going back to the beginning of the vaccination programme, again, you'll probably know that we vaccinated those most at risk of complications from COVID infection at the beginning, and working our way downwards. So by and large, the most important factor that predicts kind of complications from COVID infection is age. So that's why we started vaccinating the most elderly to begin with, and then gradually working down to the younger end of the population. we also know that there are various conditions that that increase your risk of complications from COVID. So people that have had history of diabetes or strokes or some other medical conditions would have been called earlier on, regardless of age group. So again, some of you in the student population may have diabetes, and for example, and been called already. But if you're fit and healthy and haven't been called earlier because of other medical conditions, you'll be called as and when we get to your age group. And you can see at the bottom of the slide there, as of today, the advice is that anyone who's going to be 25 and over by the 1st of July is eligible to book at the moment. Can I have the next slide, please, Ellie? Okay, thank you. So next question is, how will I be invited for my vaccine? So by and large, you'll probably be invited by text message. I'm sure just about all of us have mobile phones, so you should get an invite by text message. And again, you can see from the slide there that actually it will be sent from NHS Vaccine. And actually, when you get that message, it will include a link, so you can actually go straight onto the website to book an appointment. If you can't get online, or if you don't receive a text message, or if you don't have a mobile phone, so you won't get a text message, then you can just log on to the National Booking Service to book your appointment. And if you just type COVID-19 booking service into a Google search, you should be able to find that. Some of you may actually get invites from your GP practice for vaccinations as well. Right at the beginning of the vaccination programme, just about every GP practice in Devon was undertaking vaccinations. There's fewer GP practices doing it now, but that's another route where you might be invited from. Next slide, please, Ellie. So the next question kind of goes over what I said just now, actually. So where can I book? By and large, on the National Booking Service online. As I said, if you Google it, you'll find it fairly straightforwardly, or by calling 119. And I mentioned GP practices, but we've got mass vaccination centres. So in Devon, we've got one in, by and large, one in Plymouth, one in Exeter, or just outside Exeter. We've got one up in Barnstable as well. And there are also some pharmacies that are offering service. And again, if you book through the National Booking Service, you could be offered any one of those. Okay, thanks, Ellie. If we could just go on to the next one. Okay, so it's right at the end of term, isn't it? So that there are obviously a few complications, but there are things that might make it a bit more, not a bit more tricky, because there are answers. But we know that at the end of term, some of you might be disappearing back off to other parts of the country for the summer, or even going abroad. So we've got a few questions just to try and address that. I suppose actually just thinking back to the last slide, if you're invited to book on the National Booking Service, actually you should be able to book an appointment anywhere in the country, not just in the Devon area. So you should be able to see that when you go onto the booking service. So, but the question here is it possible to have one dose at uni if it's offered in the time I'm here, and then have the second dose at a vaccination centre nearer home, even if I'm not registered at home? And the short answer is yes. Once you've been invited, you can book your first vaccine on the National Booking Service online, or by calling 119. And actually your second dose you'll be able to book either back in Plymouth, if you're going to be back in Plymouth in several weeks' time, or if you're going to be back home with family over the summer holiday, you'll be able to book somewhere close there for your second dose. Thank you, Ellie. Next slide, please. Again, these questions are somewhat related, but what if I've gone home when I'm invited to have my vaccine? I think the advice is actually, when you're invited, just get online, phone 119 and get booked wherever you are. If you've gone back home, then you can have your first vaccine up in, or wherever you live, with kind of out of term time with your family, and then you can have your second dose kind of back in Devon kind of later on. And as it says there, the booking system will show you the available appointments near where you are. Do I have to change my GP to get my vaccine? No, absolutely not. There's no need to do that. So all of your details are kind of linked in with the national booking service. It doesn't matter which GP practice you're registered with. I know in my work as a GP, I've got some of my patients who go off to university stay registered with me, whereas others register with their GP kind of at university. But it won't make any difference with regards to you getting a vaccination. Thank you, Ellie. Next slide. Oh, and that was my last slide. So I'll hand over to Sue, who's got a few more questions that she can go through. And then after that, we'll give you an opportunity just to ask any questions you've got, and we'll do our best to answer them.
Thanks very much, Alex, and good evening, everyone. So, as Emi said, I'm Sue Wilkins. I'm Associate Chief Nurse at University Hospitals Plymouth, a Derriford Hospital, and I had the joy of stepping into the role of Director of Mass Vaccination when all this started. And probably never in my career did I expect to be looking around empty shops and football stadiums looking for places to deliver a vaccination service, but that's what I found myself doing last year. So the vaccination service both here at University Hospitals Plymouth and at Home Park is under the same umbrella, and they are now the two big, what we call large-scale vaccination sites, so mass vaccination sites in Plymouth, along with many other choices, as Alex has described to you. But it's just worth mentioning, because I don't think it was particularly clear in the earlier slide, that the hospital itself has now become a large-scale vaccination site as well. So if that is an easier venue when you go online to book, you'll be able to see that there's an option to just choose the hospital and to come and have your vaccination at the hospital as well. So it feeds in nicely to this first question, which is, can we get the first vaccine here in the UK as an EU student? And if so, how will we be contacted? And when is that likely to happen? The whole drive of the panel tonight and everyone that you speak to will be, all we want to do is facilitate people getting vaccine as easily as possible. And we will, of course, encourage everybody to come and have their vaccine as soon as they're in that eligible group. So absolutely, we're working hand in hand with universities now to look at both dedicated vaccination slots, or if we need to do something different just to make vaccination as easy as it can possibly be. And our whole motive is to encourage vaccination and not to put blockers in. So not to think, oh, EU student, let's put that person to one side. We want to vaccinate everyone as quickly as possible, as soon as that age group is open, and we will be encouraging people to come forward for vaccination and doing everything we can to facilitate that. And as much as we're in contact with key people, if anyone who's watching this tonight has any brainwaves or any ideas about how we access people easier, or we can set up services that will make attending even easier, we're already offering multiple hours and looking into vaccinating up to, well, we've done up to midnight on some nights. Any feedback that we can have that will help us develop a service that fits literally each age group we move into. So probably when we look back and we were vaccinating the over 80-year-olds in December and January, I didn't see much of a reason to be opening up till midnight. But as we've moved into younger cohorts, we've really started to look at opening earlier, certainly putting the emphasis on appointments after work as people have returned to work, and looking at having absolute evening appointments now, as I say, going right through into the night. So any feedback that anyone has, we would be delighted to hear. As Alex has described, we remain not experts, although we're living and breathing this every day. So it might be that you just have that brainwave that will encourage people to come forward and make it as easy as possible for them. Next slide, please. Thank you. So I'm planning to go back to my home country in the summer and can have a vaccine before leaving. So we sound like we're going to say the same thing again and again, but it is to absolutely emphasise that message that as soon as you're in an eligible cohort for vaccine, wherever you are, we would encourage you to have that vaccine at the time that you're invited to it. We know that the sooner we get people vaccinated, the better effect that it has. And we have quite rightly pressure put on us as soon as we receive doses of the vaccine to get them delivered to people. And that isn't because it isn't for any reason other than the fact that we don't want that vaccine just sitting there. It doesn't have any effect if it's not delivered to people. So as soon as you're called forward, as soon as your age group is open, just get on, get that vaccine booked. Or if you're not feeling in a position to have your vaccine appointment booked because you've got further questions, get those questions answered. Don't just pause and ponder on them. Just come forward and have any concerns answered so you can make an informed decision about having the vaccine or not having the vaccine. Next slide, thank you. So is there any problem with having one dose here and another dose in Turkey, which is the example in this particular question? And it goes back to my previous point. Don't delay. We absolutely see the reciprocal side of this. So I've had many situations where people have had a first dose in another country and had a need to then come to this country, obviously not for simple travel purposes, but reasons generally of redeployment. And we are incredibly familiar with looking at the vaccine schedule that someone has had in another country and then giving the vaccine here. So don't delay. It sounds like I'm saying the same thing again and again, but do not delay. As soon as that opens to your age group, please get on and book your vaccine. Thank you. Next slide. So the logic question, probably the crux of what this is about, is there proof that the vaccine reduces transmission? And it sounds like we talk an awful lot in statistics when we talk about vaccine and when we talk about COVID, and we're always asking people to take a leap of faith, aren't we? But the evidence base that we have available to us improves all of the time, and the NHS advice states that research has shown that vaccines significantly reduce that chance of you getting seriously ill or dying from COVID-19, and it reduces your risk of getting symptoms even, and it helps reduce the risk of catching and spreading. So exactly as Ruth described earlier, nobody is claiming that it totally stops you getting or transmitting COVID. It reduces that risk, but it certainly reduces your risk of getting seriously ill or dying from COVID-19. And the second bullet point there is around the effectiveness of vaccines in general. WHO is the World Health Organization, and they estimate that globally, this huge saving of lives each year by vaccine. So as I say, it feels a bit of a leap of faith. If you go online and start looking at the evidence, you can of course find contradictory evidence based on most things, but we just ask that you use those trusted sources, and the World Health Organization and the information that comes through the NHS websites are the correct place to go. Next slide, please. So we were all dreadfully upset and disturbed when we started to see these first cases of tragic consequences of people post having the AstraZeneca vaccine. And it initially was, needless to say, a shock to us all. But as we've started to analyse exactly what this looks like and the risk that is actually associated, you can see that for the kind of age groups that I'm sure we're talking to tonight, so 18 to 29-year-olds, the risk of a serious consequence is 1 in 50,000, and for 18 to 29-year-olds, and the risk of having a serious consequence of having COVID itself is actually higher than that. The reassurance is, as we've explained, that we have the 2 other vaccines, both Pfizer and Moderna, that we're using with younger cohorts. if anyone was in a younger cohort and had a reason for having AstraZeneca before that guidance was changed, we are still using AstraZeneca for a second dose, but we're not giving AstraZeneca as a first dose now to anyone in a younger age group. And it's had these slides beautifully put together for us, and it sounds like I'm being awfully repetitive, but it is just reiterating, as soon as possible, have that vaccine and just reduce the chance of passing on the virus. Thank you. I think I'm going to be moving to next slide. Thank you. It's something that's absolutely my bread and butter as a midwife of many years, talking on the subject of both fertility and pregnancy with both COVID-19 and the vaccine. So COVID-19 advice has changed with regards to having the vaccine, and we are now wholeheartedly recommending that anyone who is pregnant comes forward and has a conversation with their midwife or their obstetrician with regards to having vaccine, but the advice remains that the vaccine is still recommended. And there has been an awful lot in the news around fertility and the COVID-19 vaccine, and the Royal College of Obstetricians and Gynecologists have come out with a very firm statement that basically is saying there is no physiological reasons and no obvious reason why fertility should be affected subsequent to having a vaccine for COVID-19, and they're not supported in any which way. And I think probably at the outset of the vaccination programme, it was the most, not just the most asked question, but the biggest reason that there was concern about fertility. So that has now been looked into a lot further, and a very clear statement has come out now regarding that. Thanks, Emi. Next slide. So just briefly in summary, and then hopefully we'll get to some very good questions from you all. Vaccines are effective. I'm sure that that's palpable now in how it's feeling, despite what we're hearing about different variants and a potential increase in cases. We know that vaccines are effective, and the benefits really do outweigh the risks. And we want to vaccinate people as soon as we have the vaccine available to us. Why haven't we vaccinated more people quicker? Why are people in the age groups here tonight still waiting? Well, that has been associated with vaccine supply. And as soon as we have the vaccine available to us, we are opening up every opportunity we can to be able to vaccinate. And we are very nearly at the end of what has been a marathon, and moving down into those youngest cohorts. So we would encourage very much that as those text messages land, but not just when the text message lands, that's not the really relevant bit. The second you hear that your age group has opened, you will have a facility to book. And then there's a link there for a survey, and I will hand back to Emi. Thank you.
Thank you so much, Sue and Dr. Alex. That was really informative. I know I've learned even some more about the vaccine and about it in general, so that's really helpful. So now we're going to start to take questions. So how that's going to work is, if you want to raise your hand in the Zoom function, raise hand, then I will call on you and we will unmute you. And if you want to put your camera on, that's great. We'd love to see you. But again, just a reminder that it is being recorded. So if anyone has some questions, raise them now. If not, I've got a couple that I've come prepared with earlier, but I'll see if anyone has some to begin with.
Emi,
yes,
sorry, it's Alex here. Can I just say a couple more things, actually?
Of course you can.
Yeah, so I was just going to say, so at the just thinking about the student population and the age group. So at the moment, it's if you're going to be 25 and over by the 1st of July, but actually the age group will come down fairly quickly, I think, in the next 3 or 4 weeks. So I would expect that most of the people watching this, most of the students across Devon will be eligible for their first vaccine within a month or so. So keep your eyes peeled to the media, because as Sue says, you don't need to wait until you get your text message as soon as you see in the media that your age group is eligible, just phone 119 or preferably go onto the national booking system online. So that was the first thing. And the other thing is one of the questions was about does COVID-19 vaccination reduce transmission? And I think I might look to Ruth just to make sure I'm saying the right thing, but I don't think there is firm evidence at the moment, or I don't think we know definitely that it reduces transmission, but I think we're increasingly confident that actually it does reduce transmission. So that's a reason to get the vaccine in itself, but Ruth can probably elaborate on that a little bit.
Yeah, you're absolutely right. There's evidence that there's evidence that has come from people who've had the first dose that it reduces transmission. I'm not certain exactly by how much, but I think it was around 50–60%. But there were quite large error bars around that because it's quite hard to study it, and they basically look at how much you pass it on to your household contacts compared to people who hadn't been vaccinated, and there's not that many people that have been infected because we've had lockdown, etc. So it's a little bit it's quite hard science to be really categorical, and there just haven't been enough infections and passed on infections in the people who've had 2 doses yet to be sure of the statistics, which is actually in itself is really good news because it proves that there aren't that many people who've had 2 doses who are getting infected and passing it on. Otherwise we'd have more data. So as Alex says, we know it's going to help. We just don't know exactly how much it's going to help by, but it's definitely going to help, and probably by 50% or more.
Yeah, and that's really good, especially as students start to return to uni and be mixing with so many different people.
Yeah.
So that's really helpful to know. We've not had any hands up yet. Oh, actually, Katie Majors just put her hand up. So we're going to unmute you, Katie, and then you can answer your question. You'll ask your question even.
Brilliant, thank you. Yeah, so my question is to do with the Moderna vaccine. So I have heard about research being conducted by researchers at Imperial College London looking into the impact that the Moderna vaccine has on the menstrual cycle. Do you mind just telling us a bit more about this? Just to give it some context, the reason I'm asking is that we have breast cancer in my family, which is estrogen driven, and it makes me incredibly nervous about getting the Moderna vaccine for that reason. Thank you.
So I'll pass that over to any of our panel members, whoever feels the most qualified to answer that question.
I'll have a go at that, Emi. Actually, I got some notes somewhere on this because we've been asked before. But thanks for the question, Katie. I think there is some evidence that that actually having a COVID vaccine can alter your menstrual cycle, I think, for like the next period. So sometimes it might be a little early or a little bit late, or ladies might get a little bit of spotting. But there's no evidence at all that that the COVID vaccine causes any long-term effects with regards to your concerns around sorry, someone's sending me emails, so that's why it's pinging in the background. So there's no evidence that that there's of any long-term kind of side effects, including kind of cancers of the womb and clots and things. So again, my advice to you would be to have the vaccine. There are all of the vaccines that we've got available in the UK. As I said earlier, they're kind of independently validated for safety and efficacy. So efficacy is the effectiveness. So that all of them are effective, all of them are safe. And so at the moment we've got the Pfizer, Moderna and the AstraZeneca. We're likely to have some other vaccines in the future. I think the Johnson & Johnson one, I can't remember what it's called, either just has been or is going to be approved in the UK. So we will have access to lots of them. But yeah, I think take whichever one you're offered. But obviously there is more of a concern around the AstraZeneca in younger people. And the advice there is that the the risk outweighs the benefit. So unless there's a really good reason, if you're under 40, you shouldn't have the AstraZeneca.
I just come in and just say the impact on menstrual cycle for the Moderna vaccine is about to be mentioned in their list of risks, which is just the side effects really, and it's going to sit from the information that we've been given, it's going to sit in the uncommon category, which is classified as may affect up to 1 in 100 people. So that's where, from the information they've got so far, it's going to sit. So that just gives you a bit of a feeling about how many people that impacts on.
Thank you so much. Katie, would you like to ask any other questions to follow up on that?
No, I don't have any follow-up questions for that. I do have another question actually just slightly linked, which is to do with which vaccine will be offered, because I phoned up the 119 to talk to them about this, because to be honest, I'd rather have the Pfizer just because of my concerns with Moderna, and I appreciate everything you've just said. But on the phone, they told me that there is no way of knowing until I turn up on the day. So I was just wondering, I've been spending about 2 weeks trying to work out what vaccines are being offered in the Plymouth area. Yeah, will I be given a choice when I turn up to have my vaccine, I guess, is my follow-up question.
Shall I have another go at that, Sue, and then maybe bring you in as well? So Katie, I mean, effectively, none of us have a choice as to which vaccine we get. There are three. There's going to be 4 vaccines. As I just said, that they're all kind of equally as effective, and notwithstanding the concerns about AstraZeneca, that they're all equally as safe. So I can't see you, but I'm guessing you're under 40, so you certainly won't be offered the AstraZeneca, but potentially, depending on where you go for your vaccine, you could be offered Moderna or Pfizer. But actually, each vaccination site, but we don't have any say over which vaccines we get sent. It's all controlled nationally, so we can't always say actually you will be having Pfizer or you will be having Moderna, but we do know that with the supply that we get, that we won't be offering AstraZeneca to anyone under the age of 40. Sue, do you want to just add to that a little bit?
Yeah, thanks, Alex and Katie. I just wanted to add that nothing that you've said is leading to anyone thinking that you would, other than personal preference, need one vaccine or the other. But just for reassurance, at all the large-scale sites, we have the option of talking to a medical colleague before you actually have your vaccine. And there are circumstances where people attend and for whatever reason a decision is made that they're not suitable for the vaccine available on that day if there really is a clinical reason. So there is the option to talk to somebody at any of the large-scale sites before you go ahead and have your vaccine, if that's what you wish to do.
Emi, sorry, just one other thing, just to reassure Katie that actually some of the concerns that she's expressing are completely normal, completely understandable, and we're vaccinating 60-odd million people in this country, and it's only natural that people are going to have concerns and have questions. So yeah, if you're worried, really important to ask the questions, but we can't say actually you can definitely have Pfizer or you can definitely have Moderna, but we will make sure that what you're offered is safe given your past medical history and your age.
Thank you. I'll follow up on that for Sue. You said that Katie, when she goes, she has the option of asking to see a medical advisor and go through that. Is that something she has to do on the day, or can she do it before?
So when you attend a large-scale site, there is a booking in process, and everybody meets with somebody at the outset where they go through a standard batch of questions, and if those questions lead to needing to or even wanting to see a medical colleague, that's absolutely available. So yes, it's on the day.
Perfect, thank you so much. Okay, so the next person is Dimitrij. I apologize if I've said your name wrong. We're going to unmute you again. Feel free to put your camera on, but no pressure.
Thank you very much. That was a really interesting and a very good presentation. I just have a couple of questions, mostly about the Pfizer and Moderna vaccines. And those two questions are kind of related. Pfizer is using that new RNA technology. And there is a lot of skepticism from people who are not in the medical field about this. And my biggest concern is, are there any reassurances or studies that could have been done about potential long-term effects of that new technology? How can we be sure that in 5 or 10 years we will not have side effects from applying that new engineering technology?
Ruth, do you want me to have a go, and then maybe you can help as well? Thank you, Dimitri, for your question. And again, this question is one that's commonly asked. So it's not a problem at all with you asking it. I mean, also, there are different vaccine technologies, some of which have been around for longer than others. I think that with regards to mRNA, this type of vaccine has been in development for a long time, so far as I'm aware, and it hasn't just been rushed out quickly for COVID-19. And again, I'll look to Ruth maybe to help out, but I think have mRNA vaccines been used in some other diseases? Has it been used in the Zika virus in Africa? So I think I can see Ruth nodding. She can probably come in a second. So Dimitri, it's not a completely new technology, and I think that there has been lots of kind of misinformation out there about mRNA vaccines changing your DNA, but it's not the case. And as I said, these mRNA vaccines have been in development for a long time. It isn't just in the last year. Can you add anything to that, Ruth?
Well, I can't add a huge amount other than to confirm that you're right, that the Zika virus does use mRNA, but I'm not too sure how long that's been in play. But certainly, as you say, this isn't, it isn't brand new for COVID. It had been a tried technology previously. And I also believe it had been used for other conditions, but it's a little bit beyond my skill base to talk too much more about that. But we can certainly find out a little bit more and perhaps add some information to the website where we're going to be, storing the link for this to let you know more in more detail.
Thank you so much. You said you had a few questions, Dimitri. So do you want to ask your next one, or if you had any follow-up?
Yeah, this is it. Thank you very much.
Actually, Dimitri, just what I don't know whether this is reassuring or not, but I've had both my vaccines, as I'm a healthcare worker, and I had both my doses were Pfizer, and I didn't have any doubts about whether to go ahead with it. And likewise, my wife has had the same, and I think that the medical profession certainly have faith in the virus and the mRNA technology.
Okay, thanks.
Thank you. We've not got anyone else who's raised their hands, but again, if you want to ask any questions, you can put them in the chat, or you can use the raise hand function. I have a question then. It's based off what you've just said, Alex. So I was speaking with my friend yesterday, and they're 25, so have just been invited to go get the vaccine. But they were concerned because they thought that the mRNA ones do change your DNA. So you said that's not true, but how does it work?
Oh no, you're asking me a really difficult question there, Emi. I don't know the exact. I should do. Sorry, I feel really bad. I don't know the exact detail. But basically, the way that vaccines generally work is they trick your body into. Actually, I'm sure Ruth will be able to help me out. But they trick your body into thinking that they come into contact with the virus. And actually the vaccines basically cause an immune response to one of the what are called spike proteins on the coronavirus, on the surface of the coronavirus. you'll probably have seen kind of pictures of the coronavirus with a circle with lots of kind of triangles on top. So it's covered in spike proteins, and so when you get the vaccination, your body comes into contact with some of that spike protein and develops its own antibodies. And then so you have those antibodies that sit in your bloodstream, and the idea is that actually when and if, sorry, not, I should say if and when, not rather than when and if and when you do come into contact with the actual virus itself, the body has already come into contact with that spike protein, and so it produces a much quicker and much better immune response than if you just got COVID, than if you just came into contact with the coronavirus without having had the vaccine. Does that make sense? Again, sorry, looking to Ruth. Ruth might be able to add to that.
There's not a great deal I can add, other than to say that I think people get confused about the term genetic code, because the mRNA uses the virus genetic code, a little bit of it, which is engineered and as Alex says, mimics the spike protein on the virus to trigger your immune response. I think sometimes people hear genetic material or genetic code or RNA and think that must automatically mean it enters our own genetic code. It doesn't. It's the genetic code that triggers the immune system to work. So this isn't getting quite technical in terms of how these work, and I don't think I'm able to explain it much more than that. But you know, as we say, it mimics our own body. It doesn't get into our own DNA. It makes our own body recognize that spike protein on COVID, and therefore we've already got those antibodies to respond to it.
Yeah, thank you. That's helpful, and I can go back to my friend. I just know that if one person thinks that way, then there may be people on the call who might not feel as confident to ask that question.
Emi, can I just add, if people go on, there's been an award-winning short video of how mRNA works, produced by Harvard University, and if you go on YouTube, it's there, and it is just a couple of minutes long. It's won multiple awards through COVID for being the best explanation. So I'm sure if someone went on YouTube and looked at Harvard University, how does mRNA work, it would be there, but it's a really good informative little video.
Amazing, thank you so much. Might have to send that to them. So we had a question submitted before, and it says, why is there no prioritation for those who are on the frontline services?
Shall I have another go at that as well?
Yeah.
Yeah, it fits in with what I was saying earlier, Emi, about actually the NHS takes advice from this independent body called the JCVI, and actually they look at the vaccine, they look at COVID-19, they look at all the evidence and advise us on the best way to vaccinate the entire population. And actually what this is, what the vaccination, or the way the vaccination program is designed, is to reduce as much as possible. Sorry, more emails. The program is designed to reduce the risk of mortality, serious illness, admission to ITU, admission to hospital. And we know that, again, as I said earlier, the preeminent factor that increases the risk of all of those things is age. So that's why the first, from memory, the first 3 cohorts we did, there are 12 cohorts in total. The first 3 cohorts, I think, were done in age banding, so from the highest to the and going down, I think, in 5-yearly intervals, and then eventually it gets to the point where the risk of age and the risk from having certain medical conditions, kind of the balance shifts. So that's why there's a cohort of people with diabetes, heart disease, stroke that kind of sits somewhere in the middle of the age group. Sits somewhere in the middle of the age cohorts, and that's we're just following the advice to reduce, to protect as many people as we can, really. Does that make sense? Sorry, I waffled a bit there, but I hope you got the idea.
Yeah, that does make sense. Thank you. So we've not had any hands up, so I'll go on to my next one that was pre-submitted, and it says, do I get a vaccine if I'm a British national, but I'm not currently residing in the UK? So basically, they're not living in the country.
Does someone else want to go at that?
I don't know the answer to that, but I'm not sure how they'd physically get it if they're not in the country.
Actually, I think I might be able to have a stab. I think if you're out of the country, then you should probably have it wherever you are. But again, I have to confess, I haven't seen the rules and cohorts in all different countries across the world. They will be different. They probably won't be hugely different, but they will be slightly different for a number of reasons. And obviously different, again, you'll all know, kind of watching this webinar, that actually that the UK has been kind of right at the forefront of ensuring we've got enough vaccines for our whole population. So there'll be something about the cohorts, depending on which country you're residing in, but also about vaccine availability. So if you're eligible in the country in which you're living, I would go ahead and get it done there. Clearly, if you're not eligible there and then end up back in the UK before you've had your first vaccine, then you can get vaccinated here, assuming you're in the cohorts that we're able to vaccinate at the moment. Actually, one thing just to say, I think there are 4 or 5 countries in the world that where it's kind of acknowledged that that actually the vaccine program has gone really well. So the UK is one of them. I think Israel is right towards the top, and I think Dubai or the United Arab Emirates, and also the USA as well. So I think there may be a couple of others, but those are by and large the countries that have felt to have performed best with regards to vaccinating their whole population. But clearly there's lots of sorry, I'm going off the topic a little bit, but it's kind of a really interesting debate, because actually there are lots of countries in the world where lots of poorer countries in the world where they don't have such good healthcare, such good access to vaccines, and ultimately, if we want the world to get back to to normal, or whatever the new normal is, we need to make sure that we vaccinate as many people across the whole world. Again, you'll have seen there are discussions about some of the richer countries like ours potentially donating some of our spare doses to some of those poorer countries. And from a whole world population point of view, I think that's going to be really important.
Yeah, definitely. We've just had some new people join in. So if you do want to ask a question, then you can use the raise hand function on Zoom, or you can put it in the chat to say that you want to ask a question. And again, if people don't feel comfortable asking a question using their mic, then feel free to put that in the chat and I can read it out for those watching the recording. So another question that I have here is, why is it written on the WHO website that the interval between getting your first and your second dose is 21 to 28 days, but in the UK it's from 11 weeks?
Do you want me to? I'll make a start on this one, shall I? And then Alex might come in afterwards. So there was lots of debate about this early on in the vaccination programme. And what that centred around really was the balance of risks here. And what is actually, I think, the Chief Medical Officer, Chris Whitty, who had to make a bit of a judgment call on this. Because when you looked at, at that point in the pandemic, when we started this vaccination programme, don't forget that there was around the point that was about 1,400 to 1,500 people were dying every day. And what was looked at was, how do we protect the most people quickly? And we knew that the vaccine, the first dose of the vaccine, provided quite a lot of protection, not all of the protection that you can gain, but if you look at the sort of amount of gain you get, much bigger from the first vaccination than the second. And so if you just think about the individual, then yes, you might want to give the person 2 doses within, with the 4-week gap, that makes sense. But if you look at saving a population and saving the thousands of people, and don't forget as well, there was a constrained vaccination supply as well. So you've only got so many vaccine, you've got an awful lot of vulnerable people there who are actively at risk of dying. The decision that was made was that it was better to give a larger number of people the sort of 60-odd% protection that 1 dose gave, than to give a smaller amount of people a bigger share of the vaccine and give them their 2 doses within 3 to 4 weeks. So that was the judgment made. And if my memory serves me right, it was based on, although some of the trial data was using the 3 to 4 weeks that the WHO website refers to, there was quite a lot of other data that wasn't published in quite the same way that they looked at to make that decision. So it was a question of, it's one of the things we quite often have with when you're looking at the health of the population versus the health of one person. And if you're just treating a patient in front of you, then you might have given them, those 2 doses. But actually, if you're looking at the best, how to save the most lives, and that was what that was the stage we were at. So it was a calculated judgment call based on data that they did have and estimations and a lot of monitoring to see. And then sure enough, as we went on, the trials then, and not the trials, actually the actuality of what was happening started to absolutely prove that that was probably the right approach. And in fact, I think there's a BMJ paper that showed that it looked like that may actually have increased the protection that people got overall. So it's a good example of a situation where you might do things slightly differently because you're in a pandemic situation and you've got reduced resource. You have to make decisions about what's the best use to protect the most people with that very, at the time, the very limited supply of data, of vaccines that we had. And it turned out to be, the right judgment call. And that's because it wasn't just a random call. It was based on good evidence. And so that's the reason why.
Thanks. So even though you have delayed it, well, not you specifically, but it has been delayed for a certain period of time, it still is as effective. Is that correct? Like, students who get it will still be as protected. Yeah,
and there was the evidence seemed to show it was actually more effective with that delay in it. So yeah, these things do change a little, and obviously there is some called when you then start to have more plentiful vaccine, and we got down to those priority risks that were incredibly vulnerable. One of the things that's being done in some of the areas that have the high Delta, the high new variant, is escalating that program again. So it's when you suddenly find that you have more plentiful vaccine and you've already vaccinated your most vulnerable people, then the risk equation can slightly change. But at that point in the pandemic, that was absolutely the sensible decision, and we did quite quickly see rates falling in our care homes and in our most vulnerable people.
Yeah, thank you. I'm sure that will make people feel a lot more comfortable when they go get it. So you mentioned about the new variant, and I know that some people are a bit worried that the vaccines are not going to be as effective with the new variant. Is that true, or is that? I'll come back to you, Ruth.
Yes, so it takes a little while to really get all of the data on something like this, because it's the new variant is pretty much a new disease in a way. It's very, very, very similar to the one we know we're dealing with, but when you're looking at trying to assess it, you have to have enough cases, etc., to be able to really understand what the difference is. And any of you at university who were doing the kind of the science around doing experiments and trials will know that with statistics you get big margins of error if you don't have enough numbers. So at the moment, the thinking is that it is more transmissible normally. It gets past, it infects more people, can be slightly more serious as well. and that there is a difference in the vaccine effectiveness, but it's relatively small. So the vaccine looks like the vaccines, the information we have so far looks as if they are slightly less effective with the Delta, but still very good. And actually, if you look at the COVID vaccine compared to many other vaccines, it is incredibly good. So to some extent, you know, it's not the end of the world if we lose. The figures I've seen were about 7-8% less effective, but I do know that those were provisional and it is changing as they get more data. So the honest answer is yes, but only by a small amount. And so the vaccine is still incredibly valuable for all of those reasons, in particular saving yourself from serious infection.
Yeah, thank you.
Sorry, just to add to that, again, it's natural that people are worried about the new variants, again, because we see it every day in the news, but actually having variants of viruses is not unusual. It's really common. Every year, think about the flu virus for sake of argument, that there's loads and loads of variants of that, and the prevalent one changes every year. So absolutely understand that people see things on the news and worry about it, but it's not unusual, it's not uncommon. And just while I've got the mic, so I can see that Christoph has just asked in the corner there, as an EU exchange student not having a GP here, where do I get the vaccine and who pays for it? So the short answer, Christoph, is when your age group is eligible for vaccination, and I think you've only just joined, haven't you? So at the moment, anyone who's going to be 25 or over by the 1st of July is eligible now. But even if you don't have a GP, if you're an EU student, then when you're eligible, you can either book online, and I was saying earlier, if you Google COVID vaccine national booking system, you'll find the website, or you can dial 119 and there's no charge for it, and you don't need to be registered with a GP.
Yeah, and that's such a good question, Christoph, because we have so many different international or EU students who come over and may not be registered yet and may not see the point in registering for a short amount of time. So it's really good to know that you'll get that vaccine. So I had another one, and it's, so many students, not just students, but young people, feel that they don't need to get the vaccine right now and they can just put it off because there's no rush. What would you say to them? It's not so much of a question, but
you can probably guess what I'd say to that, Emi, can't you? I mean, I suppose it goes back to what we've kind of covered over the last hour or so. So the vaccine is safe and effective. By having the vaccine, actually, not only do we protect ourselves, and actually for young, I'm not so young anymore, unfortunately, but for young people, actually, it's in fact for everyone, it's about protecting others as well. So protecting the more vulnerable in our society, and that might be our mother, our father, our brother, our sister, granny, granddad, someone we come into fairly close contact with when we go to Sainsbury's to do our shopping. It's about protecting us and protecting the wider population. And again, going back to what I was saying just kind of 2-3 minutes ago, actually what we need to do for the whole world to get back to the new normal, we need to vaccinate as much of the world's population as quickly as possible. And the quicker we can do that, the quicker we can get back to a more normal life.
thank you. And I would just add to that, actually. Many students, or not even students, may think that actually everyone at university, they're healthy and they're young, but that's not always the case. We have all sorts of different people from all different walks of life. And while some people might appear healthy, they might be vulnerable, or like you said earlier, may not have produced those antibodies. So it's just about like not assuming, isn't it? And making sure that maybe you assume that everyone's more vulnerable than assuming everyone's healthy.
Ellie, sorry, the other thing to say is that although if you're 18, 19, the likelihood is if you get COVID, it'll be a minor illness and you'll be fine. You could be that one person that that isn't so lucky. So it is about protecting yourself and protecting others. And again, we'll all have seen over the last 18 months kind of occasional stories in the paper where an 18-year-old or a 19-year-old with no other medical problems has come to serious harm from COVID or long COVID. So none of us know whether we're going to be the 99% that are lucky when we get COVID and come through it absolutely fine. We might be that one that does get seriously unwell, end up in hospital, end up in ITU, or even worse.
Yeah, that's an important reminder. I've just got 2 more questions. Again, if you're watching, feel free to put them in the chat or raise your hands. Otherwise, after that, I will finish for today. But the question I have is, say I'm an international student and I get my first dose in the UK, but then I'm going back to a country who might not be as far advanced in their vaccination program. Is there any risk in me getting my first dose here and then going back to my country where it may be longer than maybe even the 11 weeks that the UK is saying?
Can you do that one, Ruth? Or
So my understanding of the advice there is that have that first vaccine, because you will then get a certain degree of protection. It's not quite the same as 2 doses, but it's an awful lot better than nothing. And so, you know, if it's not going to be known, it's not obvious when you might get the full dose in your home country, it's far better to get that first dose when you can, when it's offered you, and get that protection.
I suppose the other thing, just to add to that, Emi, is that at the moment everyone's going to be getting 2 doses. We don't know at the moment what's going to happen in the future, whether we're going to need booster doses kind of annually or whatever. And again, some of you may have annual flu vaccines because your carers or got medical conditions. So quite a lot of my patients have annual flu jabs because they're at risk from flu, and we need to. Well, I think that the JCVI and the government need to decide what's going to happen later on in the year and in future years. And clearly, as we've said, actually COVID's only been around for 18 months. We've still got lots to learn about it. We need to understand. I think we've got a pretty good idea how well the vaccines work in, but we need to look at the evidence and work out whether which patients and how often we revaccinate if we need to.
Thank you. I've just had a couple questions DM'd via the chat. And the first one is, what documents will be issued to a student after receiving the first component of the vaccine?
I can probably have a go at that one. So, and I can probably expand on it a little bit, actually, Emi, with regards to the second one as well. So when you attend a vaccination site for your first vaccine, you will probably be given a little card, and you may well have seen people sticking photos of them on Facebook or Instagram. So I'm sure you know what they look like. But it'll have your name and your date and your batch number, and then you can bring that back when you have your second vaccine, and that will be the second bit will be filled in. And I know, because I've been jabbed twice. Actually, no matter where you're jabbed, the information will end up in your GP record if you're registered with a GP. And it also links with the NHS app. I don't know whether some of you probably downloaded the NHS app, but if you download the NHS app, actually the fact that you've had your 2 vaccines will end up in your app. And actually, I think one of the ideas of that is as and when we're allowed to travel out of the country, I know we can to some places already. Actually, that app can be used as evidence to show that you've had your 2 vaccines. if you don't have a smartphone or the app, and you want evidence that you've had both of the vaccines, again, you can, if you phone 119, they can look up your details and they can send you a letter that you can use as proof. I think you need to wait about 5 days or so after you've had your second vaccine for it to appear in your app or to phone 119. And if you are going to phone 119 to get a letter, I think they need about 7 days. It might take about 7 days for that letter to get to you. So if and when we are allowed to go on holiday a bit more freely, just plan ahead, particularly if you're going to need to phone 119 for that evidence.
That's really helpful. I wasn't aware of that, so I'm sure many people on the call wouldn't be aware of that either. The student also asks, can a student face denial of a second dose in another EU country? I don't know if you'll be able to answer it, but do have a stab.
So, sorry, say that again, Emi. Sorry, I missed that.
It said, can a student face denial of a second dose in another EU country?
Face denial, sorry, was that?
So I assume they mean like not be allowed to get their second dose.
In an EU, in a different country?
Yeah, so if they're getting the first dose here and then they've gone back home to another EU country, can they?
Yeah, so every country has slightly different rules and vaccine availability, and different vaccines available. Not just the numbers of vaccines, but the type of vaccine. So and again, I think this will be a bit of a moving feast over the next few months, not just in the EU, but across the world. So I think my advice would be, actually, if you're in the UK, when you're eligible for your first dose, get it done. And then if you're elsewhere, if you're elsewhere for your second dose, I think I'd advise you to take the advice of clinicians in whichever country you're at. But as I said, I don't know the details, and it will be different in different countries.
Thank you. They've had another question, and I'm not sure you'll be able to answer it again because I don't know if it's a thing yet, but it says, who will provide the vaccine passport at the end? So if the first dose is in, say, the UK and the second dose is back in a different country?
Oh, do you know, I do know the answer to that, and it's not a good one. And because the question's been asked of me this week, actually, Ellie, and I've kind of raised nationally to find out the answer. Now, the question I was asked is a patient in Devon who was working in Baghdad, I think, and had both their vaccines over there, and has a record of it, but it was done in Baghdad, and so there's no way at the moment. There isn't. I as a GP, I can get it in my patient's medical records, so I can put it in their GP records, but it doesn't link up with either the NHS app that I was just talking about, or with the calling 119 and calling 119 and having it on the app. Now, I haven't got a clue what the answer is to that long term, or whether there will be a solution forthcoming. So we'll need to wait for further guidance on that. Sorry, I can't be more reassuring, but yeah, it's a tricky one, that.
Yeah, thank you. It's good that you could even just provide any sort of answer. I'm sure that will be helpful for that student. Christoph in the chat says, how do you estimate the risk of vasovagal or allergic reactions on the vaccination? So
I can answer that. So a vasovagal, for those of you who don't know, is basically a faint. Now, how many vaccines have I don't know how many I've done personally, but in my network of GP practices, we've done about 31,000 doses, and we are not aware of a single person fainting. we've had 2 or 3 people that have felt a bit dizzy afterwards, and actually I've looked after a couple of them, and they've laid down for kind of 10-15 minutes and been absolutely fine. I've had a few patients who are very nervous about having the vaccination, either because they're worried about side effects or because they're needle phobic. But again, my service and I'm sure all of the others are quite happy to make adjustments for those people. So a couple of those people who are really nervous and worried about fainting, I've taken them out the back and had them lying down on a couch, and given them their vaccine when they're lying down and away from everyone else. Yeah, if any of you are worried about that, please have a conversation with the site that you're going to have your vaccine. With regards to sorry, the other bit of the question, if I just scroll up, was about allergic reactions. Again, right at the beginning when we started giving COVID vaccines, I think on the first day there were 2 fairly severe, what we call anaphylactic reactions that were reported, and so that I think we were worried that there might be lots more of those. Thankfully, touch wood, there have been some, but then there are anaphylactic reactions to any type of medicine that we give, but the risk is relatively low. And actually, I think we know that for some people that have anaphylactic reactions, we know that the ingredient in the vaccine that causes it. So people that have had anaphylactic reactions to that bit of the vaccine in the past, particularly with regards to Pfizer, we advise them to have a different vaccine. And also we get as GPs or other vaccination sites, we can get really good advice from our immunologists, so our specialists in kind of allergies and allergic reactions, so that we can make sure that we give people vaccines that are safe for them, particularly in those people that have had history of allergic reactions or anaphylactic reactions. So that's a very long-winded way of saying actually that although there are anaphylactic reactions, that the numbers are few and far between.
Thank you. So would you suggest if someone knows that they have like a history of having that sort of reaction, that they just raise it on the day to those people, the medical advisor that you're talking about earlier?
So actually, Sue, can you maybe answer that?
Yeah, thank you. So we have a very specific clinic for people that have a known serious previous reaction. So that's not just your faint associated with having vaccines or any injections in the past, but people who have a history of having full anaphylaxis or a significant allergic reaction. We book them into a very specific clinic where we do some enhanced observation after their vaccine. Again, if anyone hasn't brought that to anyone's attention and attends for a normal vaccination appointment, that will be absolutely assessed in those opening questions. And if they are in the wrong destination for that individual's previous medical history, they'll be redirected to the appropriate clinic. So yeah, if the first opportunity that you've had to discuss that is when you physically attend for your booked appointment, please do not worry, there'll be an option to go through the best place to have the vaccine at that appointment.
Amazing, thank you so much both. Alex, did you want to come back on that one?
No, that's fine. I can just see Katie's asked another question. Katie, sorry to hear that your mum had severe side effects after having the AstraZeneca. Sorry to hear it took her several months to recover. Again, the risk with any of the vaccines is really low, Katie, and I suspect that your mum was just unlucky. No medical professional could ever say that you definitely won't have a side effect from a vaccine, but the probability is really low that you will have a significant side effect. And as you, just looking at the question, I think what you're implying there is that your mum had AstraZeneca and you might be having a different one, and absolutely that's the right thing to do. As I said earlier, I'm guessing you're under 40, but having Pfizer or Moderna is the right thing for your age group, and chances are you'll be absolutely fine. And again, speaking from experience, I didn't really have a reaction to either of them, and been vaccinating thousands and thousands of people, and the number of patients that are coming back to me saying that they've had a severe reaction is tiny. The commonest side effects are, a lot of people get no side effects whatsoever, Katie, honestly, but the commonest ones are feeling a bit achy, a slightly sore arm, and a bit of a headache. I think those are the commonest ones, but in all likelihood, you will be absolutely fine.
Couldn't find my unmute button then. Thank you so much for answering. That is the end of the session. We've reached time, but thank you so much to everyone who attended and asked questions. I know it may have been somewhat difficult with all the people's judgments around, but I hope you really got your answers and you felt that it was helpful. And thank you so much again to Dr. Alex, Sue Wilkins, and Ruth. Thank you so much. You've been great.
And thanks to you, Emi. You've been brilliant. Thank you so much for hosting it for us.
You're very welcome. And I'll just say once more that this is being recorded, and all those attending will be receiving all the information and links that were mentioned in the presentations. And if you know someone who you think would find it useful, that it's also going to go on the council's website and be sent out by the different universities across Plymouth. But yeah, thank you again to everyone who attended and who were on the panel tonight.